Okay, so injecting Frontalis with toxin, one of the questions that I am very reasonably asked at training events and different things is, does the depth of injection matter? Does it change anything if we inject more superficially or more deeply in Frontalis? You know, does it affect anything at all in terms of overall efficacy, intensity of effect, longevity? So let's take a look at that and look at what evidence is out there, because it's interesting. With time, my opinion on this subject has changed as clinical study has increased on this subject, and also a little bit of my own personal experience. You start to develop a more rounded answer to this question. So when we think about Frontalis and we think about where we're injecting, you think about the forehead, and actually the soft tissue envelope of the forehead in terms of its overall thickness. So that really is the distance between the outermost skin and the periosteum is quite short. So when you look at the study of this, the average depth is somewhere between 4 to 5 millimeters. So you're talking half a centimeter maximum in terms of distance between outermost skin and the periosteum. Now, obviously, you're going to have outliers either side of that where it might be slightly shorter, it might be slightly thicker. But on average, we're looking at 4 to 5 millimeters. And when we break down the layers from outermost to deepermost, so we've got skin, superficial fat, galea and muscle, Frontalis muscle, which are basically, the thicknesses are so thin here, we're going to call that one layer, deep fat, and then periosteum. Again, when you look at the study, the anatomical studies, applied anatomy studies on the thicknesses of these individual layers, we're looking at somewhere between 0.3 millimeters and 1.3 millimeters. So incredibly fine, thin layers that when we're using a standard insulin needle or a needle that we would typically use to inject toxin, it's going to be very practically difficult to discern between these layers. So from a practical perspective, I think really we've got two options in terms of injecting. We've got a more superficial injection, which ends up somewhere between the skin, subcutaneous tissue and Frontalis, and then a deeper injection, which is really when our needle touches the periosteum. Okay, so when we look at the literature, the evidence as it were out there in terms of does depth of injection matter when injecting Frontalis, I think that most of the earliest study on this suggested that depth probably didn't matter. But I think that the more up-to-date information tells us that by and large the depth of injection will change intensity of effect. And really the studies really fall on the side of the deeper that we inject when injecting Frontalis, so that is, for example, touching the periosteum with the needle, that the intensity of effect is probably greater. So it's more intense basically the deeper you go, if you look at the studies which tell us that depth does matter. And when you look at all these studies, it's like a lot of studies in aesthetics, they're not incredibly robust. The numbers are not massively high, difficult to draw any significant statistical conclusion from these things. But and then from that perspective, you kind of think, if the studies are suggesting this, what am I finding in my own practice? And that's really where I've kind of got to with this. So having treated thousands of foreheads with toxin over the years, I think I probably fall on the side of that injecting more deeply with toxin, touching the periosteum, does give a more intense effect for the same dose of toxin used. And from a practical perspective, how does that change things? I think for me, when I'm injecting higher on Frontalis, so let's say further away in a superior direction from the superior orbital rim, I tend to inject on the periosteum. And when I'm injecting closer to the superior orbital rim, so in a more inferior position on the visible forehead, I tend to inject more superficially in order to moderate the effect of the toxin such that it is slightly more subtle versus a more intense effect higher up on Frontalis and on the forehead. with the thinking being that I want to allow a little bit more activity in the fibers closer to the superior orbital rim versus higher up. I hope you enjoyed this content. If you did, hit like, subscribe and share to see a bit more.